I then began to see people get vaccinated in our community to keep our community safe or to keep their job. And then I started to witness the genocide. I started to witness people that were once healthy and functioning literally go crippled, literally go, have a stroke, have a heart attack, massive pain at the injection site, can't feel their extremities anymore, can't taste, can't see properly, literally can't walk anymore, in a wheelchair, and now suicidal. These are patients that I saw for like 7 years. I knew the state of their health. I knew them. It was documented. So we'd have these large vaccination centers pop up. People would go in to do their public duty based on what, Fauci is saying, Trudeau is saying, Theresa Tam is saying. They're just soaking it up, right? They're brainwashed into thinking that what they're doing is safe and effective. They are keeping their neighbors safe, they're doing their part, and they're keeping themselves safe. Meanwhile, there's so many people suffering with vaccine injuries. And I was witnessing physicians just ignore these calls for help. So I work in a doctor's office. There's a nurse, there's a physician, there's the patient. The nurse would come in, the patient would be there, we would have a conversation. They would tell me that they were fine before the vaccine and not fine after the vaccine. The doctor would come in, and we would explain this to the doctor, and the doctor would literally just ignore it, ignore the story, and chalk it up to say, oh, maybe you have multiple sclerosis, maybe you had a stroke. Okay, well, yeah, they do, but why? Let's ask the question: why are these people presenting as sick and disabled now? Nobody in the medical establishment wanted to answer my questions. And it was very clear that the College of Physicians and Surgeons of Canada and all the provinces were literally putting threats out to the physicians that if you speak about vaccine injuries, that your license is at risk. So most physicians shut up. Most physicians said nothing. Why? Because they're risking their job, their livelihood, their ways of living. I was married to one for 20 years. I saw him ignore to keep his job. I, on the other hand, could not ignore what the people were telling me. I signed up to nursing to do no harm. So if a patient is telling me that they're harmed because of a vaccine, then I have to speak up as a patient advocate. That's my role. That's my job. That's what I wanted to do. That's what I chose to do. So I started speaking up on behalf of clients, patients who are vaccine injured. That essentially got me fired. I chose not to take the vaccine in October of 2021 because I was seeing so much harm around me. Why would I take a vaccine that was going to harm me? So I chose not to take it. I got fired. I started Ezra Healing, really, truly to be a voice for people who did not have a voice. Hello, everybody. My name is Svetlana Rilkoff. I am in Kelowna, BC, Canada. I am a former registered nurse of now 24 years. My educational background is I have a Bachelor of Science in Nursing from the University of British Columbia, right there in Vancouver, Andre. And my nursing background is very extensive. I have a background in intensive care unit nursing, emergency room nursing, public health nursing, university education training our new nursing people coming out. I have primary healthcare experience, which means I work in a doctor's clinic, pretty much at a family doctor's level, and I see people. I have experience in writing prescriptions, suturing, doing women's health, writing up secondary screening programs. So I've even worked in correctional facilities. Back in the day, 15 years ago, I used to run large flu vaccine clinics. So my experience in nursing is very vast. I've done almost every type of nursing that you can think of. And I absolutely love my profession because there's a lot of different flavors in nursing. So this is just one more. And currently, I'm in private healthcare focused on vaccine injuries and cancer healing.
Okay, thank you. And what really inspired you to become a nurse?
I was really attracted to simply helping people in their time of need and traveling the world. I knew nursing was a career that I can go anywhere. And as long as I spoke the current language, I was able to basically plug myself into that country and help people. So it was job security. And just by nature, I really enjoy helping people. I guess that's my love language, is to receive when I give.
Okay. Can you talk a little bit about some of your memories from your education going through nurse schooling?
So my initial training was in Grant McEwen College in Edmonton. Looking back on it now, I was very heavily indoctrinated with the medical mafia's information. For example, my pharmacology book was about that thick with all the different big pharma medicines in there that I was supposed to learn, including, a massive chapter on vaccinations. So that I remember clearly. I remember clearly, not really being able to be super creative with my thoughts, but following in their protocols. Um, I remember, doing a lot of evidence based research and papers, not so much a lot of clinical hands on care, which I thought, I should have had more training in. But overall, my training in Grant McEwen was really great. And then I did my bachelor's by distance from the University of British Columbia. A lot of statistics, philosophy, um, higher level nursing sort of thing. So, my 25 years ago, my education was all that I can ask for, and then I did a specialty program in an intensive care unit at the Royal Alec in Edmonton. So, very well, looked after in terms of my education. At the time, I thought it was the greatest thing on earth.
They say that doctors rarely receive any education about nutrition. Is that the same case for nurses?
I would 100% say that's the same thing for nurses. I was actually married to a family doctor for 20 years, and I went through, that training with him as well. So, the amount of education regarding nutrition that both the nursing faculty and the medical faculty receive is very, very minimal. Fast forward 25 years, I'm helping people with cancer care. Diet is the number one thing that we talk about. Let food be thy medicine. What we put in our mouth is super important. I don't even remember having those conversations in nursing school. I don't remember having those conversations, as a practicing nurse. It was not highlighted as it is now. So definitely it was missed in our education system 100%, and it still is. So unless I think you go to focused nutrition or dietary school, nutrition is talked about very, very little.
Where did you first start working as a nurse, and what is one of your first memories as a young nurse, like in just starting your career?
I'd have to say the Royal Alec Hospital in Edmonton was my very first nursing job. It was in the intensive care unit setting, very critical, very sick patients, a lot of trauma injuries, people, in car accidents, in plane accidents, very, diseases that are very progressive. For example, somebody with progressive pneumonia who needs to be on a ventilator. So, it was very, let's say, maybe a sterile environment, very technical, very attention to detail. So I actually enjoyed that. Um, it was very challenging, and I love a good challenge.
Okay, thank you. Um, did you ever have any bad thoughts about the medical industry, like it might be corrupted at that time?
I wouldn't say bad thoughts at the time. I always thought, why are doctors and nurses so overworked? Why are we working night shift when that is so harmful on our body? Um, why is it always like I'm chasing I'm chasing things. Just there was never, a healthy work environment. Too many too many patients per nurse. The workload was insane back then. Never mind now. So I never thought it was corrupt because I didn't even know what really corruption was at the time. I just knew it never felt right. It never felt healthy, and often it wouldn't feel safe because we were working in unsafe work environments.
Got it. Did you ever witness a vaccine injury before the pandemic?
I'm gonna say I'm sure I witnessed it, but I didn't know what I was witnessing. I believe chronic diseases. A lot of chronic diseases are contributed by the vaccine. Cancers, from the vaccine, autism, all that, all those chronic diseases. I never trailed it back to the vaccines until the COVID-19 vaccine showed up in my life.
I see. There's an American nurse, Deborah Conrad, who was fired for reporting vaccine injuries during COVID, and she explained that most nurses that she knew had no knowledge of reporting vaccines at all, like the VAERS system. Is this something the same thing you would say about Canadian nurses?
100% vaccine injury reporting is definitely not a thing in the medical matrix. It is so not. I knew during the pandemic that it was available to us, which I thought really bizarre. I thought, so why is there even a reporting system on something that we're administering? It didn't make sense to me. I mean, if it requires a department to report to, that's a red flag for harm. So why is it even being administered? It was a very oxymoron for me. So in my career, I never put an injury with a vaccine together. No.
Okay. Can you tell us about your experience through the pandemic? Back, like starting in
Besides
2020,
wild,
can
besides
like go
wild and
back
crazy.
to how did you hear about it? What do you remember the first time you heard about it?
I was actually on a plane in 2019 going to Hong Kong and then to Asia, and I was sitting next to a gentleman who was on his way to Beijing, and he told me a story that the train station in Beijing had been shut down because of a virus. And me being a nurse, I'm thinking, wow, how does a virus shut down a train station? It just didn't make sense to me. Um, and then we eventually got to Hong Kong, where I saw all these protesters. I had never seen pretty much a protest in my life. And then we carried on to Bali in the Philippines, where I saw like military coming out with guns and temperature probes to scan for fevers, and if anybody had a fever, they would go into a quarantine hotel. It was very foreign to me to see such a drastic measure taken for a simple virus. I've been around viruses, bacteria, fungus all my life in the medical system, and never have I seen this level of intervention by politicians and military. So it was a really eye-opening experience. We basically left the Philippines 4 days before the whole country shut down. We were on a family holiday. We got back to Canada in March of 2020, and I was so thankful that I left Asia, thinking I left that virus behind me. But 2 days later, Justin Trudeau announced on CBC that there is a deadly pandemic going to be invading our country, and it's time to get all hands on deck to get prepared for the mass amount of deaths that we're going to see. So for 2 full weeks, I was full on organizing with my community, with our hospital, with our doctors' offices. We were preparing to see a mass amount of death. I literally went to the curling rink to say, there are going to be a mass amount of dead bodies here. Let's make room. Like, that was me. Now
Wow.
looking back on it, I feel like such a fool for doing that. But in the time, I was really serious and I wanted to help out. 2 weeks went by. There were quite a few red flags for me that didn't make sense, that this was something real. It started to feel uncomfortable, like this was very planned. And I was starting to see red flags. For example, there was a billing code in our doctor's office for COVID 19 that the doctors can bill for COVID 19. I'm going to help you understand this. A billing code is administered by MSP, Medical Services Plan of British Columbia, and it's trickled down to all the doctors so they can, charge the government, bill the government for a diagnosis. So this new diagnosis of COVID 19 was already in our electronic health records in our small town of Christina Lake, BC, Canada. Now, how did a billing code travel down from MSP, the federal government, into our electronic health records so fast? I thought this was just a surprise, like Justin Trudeau said. So that was my first red flag. Why are doctors able to bill for this virus already? It was like it was pre-planned. It was already pre-organized. But that's not what the mainstream media was saying. This was a sudden surprise. And then everything in the world was just orchestrating together at the same time, the same vibe, the same message. Now, I'm an emergency room nurse. I'm an ICU nurse. This was a very, in a true emergency situation, it is chaotic. There is nothing pre-planned. But there was a lot of pre-planning and strategy that I can see that went into this. So I started to back off on the narrative and started to become a detective. And no time in healthcare were we ever forced to do anything. A mask wearing, forced to wear a mask, forced to stay 6 feet away from, your work partner, forced to follow the arrows in a grocery store, forced to have a vaccine, if you wanted to get on a plane or keep your job. The amount of force that was being, implemented on us was a massive red flag. I then began to see people get vaccinated in our community to keep our community safe or to keep their job. And then I started to witness the genocide. I started to witness people that were once healthy and functioning literally go crippled, literally go, have a stroke, have a heart attack, massive pain at the injection site, can't feel their extremities anymore, can't taste, can't see properly, literally can't walk anymore, in a wheelchair, and now suicidal. These are patients that I saw for like 7 years. I knew the state of their health. I knew them. It was documented. So we'd have these large vaccination centers pop up. People would go in to do their public duty based on what, Fauci is saying, Trudeau is saying, Theresa Tam is saying. They're just soaking it up, right? They're brainwashed into thinking that what they're doing is safe and effective. They are keeping their neighbors safe. They're doing their part, and they're keeping themselves safe. Meanwhile, there's so many people suffering with vaccine injuries. And I was witnessing physicians just ignore these calls for help. So I work in a doctor's office. There's a nurse, there's a physician, there's the patient. The nurse would come in, the patient would be there. We would have a conversation. They would tell me that they were fine before the vaccine and not fine after the vaccine. The doctor would come in and we would explain this to the doctor, and the doctor would literally just ignore it. Ignore the story and chalk it up to say, oh, maybe you have multiple sclerosis, maybe you had a stroke. Okay, well, yeah, they do, but why? Let's ask the question, why are these people presenting as sick and disabled now? Nobody in the medical establishment wanted to answer my questions. And it was very clear that the College of Physicians and Surgeons of Canada and all the provinces were literally putting threats out to the physicians that if you speak about vaccine injuries, that your license is at risk. So most physicians shut up. Most physicians said nothing. Why? Because they're risking their job, their livelihood, their ways of living. I was married to one for 20 years. I saw him ignore to keep his job. I, on the other hand, could not ignore what the people were telling me. I signed up to nursing to do no harm. So if a patient is telling me that they're harmed because of a vaccine, then I have to speak up as a patient advocate. That's my role. That's my job. That's what I wanted to do. That's what I chose to do. So I started speaking up on behalf of clients, patients who are vaccine injured. That essentially got me fired. I chose not to take the vaccine in October of 2021 because I was seeing so much harm around me. Why would I take a vaccine that was going to harm me? So I chose not to take it. I got fired. I started Ezra Healing, really, truly to be a voice for people who did not have a voice. I'm a massive advocate. I love my advocacy work. It's why I went into nursing. You asked me, Svetlana, why do you go into nursing? Well, one, because I like to help people and travel, but two, I like to represent people that cannot represent themselves. Women, children, men, whoever cannot speak, I'm happy to speak on your behalf. I'm so convicted of this because I know the harm and injury. So this is wrong. This is causing harm, injury, death, disease, and death. This is why sudden infant death syndrome is here. SIDS. It's not idiopathic. We know why SIDS happens, and it's not because of the blanket that mom or dad put in the crib. It has nothing to do with mom or dad. It has everything to do with the vaccinations. Yes, mom and dad did take the child in, and this is what we're trying to prevent and bring awareness that, the childhood vaccination schedule is causing your child to have chronic diseases, asthma, eczema, and, brain seizures. So vaccines affect the nervous system no matter what age you're at. It attacks the nervous system. This is why we're seeing these symptoms of, brain fog, numbness and tingling in the extremities, worsening of your chronic diseases that you already have. So, Andre, I know I've kind of gone off topic or maybe away from your question a bit, but it really ties into it. So I can't even remember the last question you asked me. So ask me the next question.
Well, I'll give you a little bit of a break. So the first time I realized something was wrong during the pandemic was when I came across a YouTube video by a man named David Abel.
So the word respirator was used at this hospital in the ER room. We'll probably put you on a respirator. Now, I have worked with hospitals in the UK, and because of my job visiting patients who've been really ill, and I've seen lots of people that have been on respirators, and I'm not trying to scare anybody because this just scares me, and not many of them survived. So I thought, bugger that, I am not going on a respirator, even though I need oxygen in my lungs. I'm not going to go on a respirator. Now, my oxygen level was 93, and if it had dropped below 90, that's when they were going to stick me on a respirator. So I then thought to myself, even though I wasn't well, this is the night after Sally really thought I was going to pass away. I thought to myself, I have got to do something with my lungs. And I started doing lung exercises. Didn't even tell Sally, I just started doing them.
You needed to do deep breathing. I didn't know what else you were going to do, but I said you needed to try and get some oxygen into your lungs.
So many, many years ago, I used to practice a therapy called EFT, Emotional Freedom Technique. Emotional Freedom, Google it, Emotional Freedom Technique, and put in the search Gary Craig, C-R-A-I-G, Gary Craig. He's got a wonderful 5-minute video that explains how it works. And one of the exercises I used to do with EFT was expand my lungs. So this is what I started to do. And within 48 hours, my oxygen level increased from 93 to 99.
I love your video about the breathing. The red blood cell is actually what has been attacked here mainly. And when you have red blood cells that aren't healthy, they start to clump together and stick together, and you have that, that oxygen exchange is difficult. So just simple exercises like deep breathing will infuse your red blood cells with more oxygen, and it will make you feel better. Like it's that simple. Our body can literally heal itself. Many of us just shallow breathe. That's why, deep breathing exercises, deep breathing classes is actually a thing, because human beings don't use our full capacity to breathe. We're very shallow breathers, and that's not good for, if you have lung conditions. We want to recruit all those alveoli in the lungs. Going from 93% saturations to 99% saturations, that's a big difference. So the fact that they were ready to intubate him at 90% or less is absolutely effing insane. Because as an ICU nurse, once you get intubated, that's like one of the worst things that you can do for your body, is stick a breathing tube down your mouth, into your throat, into your lungs. Okay, it's very hard to come off of a ventilator, because they have to now give you drugs to paralyze you, so your body doesn't fight the ventilator. I mean, you can get pneumonias very easily being on a ventilator. So you literally, like that intervention, that simple interventions of deep breathing saved his life. It's that easy. And that is how the corruption has manipulated us into thinking that we need these very aggressive interventions when we just don't. And this is the medical matrix has gotten very scary. Okay. They are not afraid to go to the jugular. They are not afraid to do something so aggressive that will cause way much more harm than good. For example, biopsies. People are getting biopsies like crazy. But what do biopsies actually do? Well, if you're investigating a tumor, they're like, well, let's do a biopsy. But that's your body's way of encapsulating, all that garbage into a nice, formed mass. Once you puncture it, now you have a hole, and all those cells go everywhere in your body, and that's called metastasize. That's how cancer spreads. So I focus a lot on cancer, Andre, and I believe cancer to be, a vaccine injury in a lot of the cases. And this turbo cancer that we're seeing in the past 4 years, I believe is directly contributed to the COVID-19 vaccinations. I believe there were parasites in the vaccinations. So if you were injected with a COVID-19 vaccine, you were essentially injected with and infected with parasites. And that's why, they took host in your body. They feed off of your sugars and your carbohydrates that you put into your body, and they could grow mass sizes into organs, into your brain, into your blood, everywhere. That's why things like ivermectin, which is an antiparasitic, is working so well to shrink the tumors. That's why I'm actually making a dent on the oncology industry. I was in an elevator today in my building, going down. I got into the elevator. There was a lady there. She was wearing a BC Cancer lanyard and holding a BC Cancer lunch kit. So I knew she was going to work to the BC Cancer Institute. So I struck up a conversation with her, and I said, I'm fascinated by cancer. I'm learning as much as I can. I am a nurse. Are you going to work? Do you work for the BC Cancer? She goes, yeah, I'm a medical oncologist. So she's a doctor of oncology. Okay. So I was like, wow, what a golden opportunity. And I just said it. I said, gee, I heard that cancer might be a parasite infection, and things like antiparasitics could actually help. What do you think, doctor? And she agreed with me. She agreed with me in 2 seconds. She was trained in Africa, moved to Quebec. Now Interior Health just hired her here in Kelowna, BC. Okay, trained somewhere else where parasite infections are very common and rampant, and things like ivermectin are given prophylactically. Okay, it is just a North America thing, I believe, that we don't see, like parasite infections being healed with ivermectin, because they know that, if you go through the chemo and radiation, you're going to have pain and suffering, and your cancer is not going to be healed. So we have discovered this very fact. I believe that's why I got rated by Health Canada. It had nothing to do with license numbers, me not having license numbers on my medicine. It has everything to do with me making a big impact on the oncology industry. So, I considered it a great compliment, with the raid. And I'm getting these signs and confirmations everywhere that I'm on the right track. So, we can talk about more, what happened recently about the raid, and, what is Ezra Healing, and where does it go from here?
Yeah, so why don't you explain how you went from getting fired as a nurse or as a registered nurse and then building up Ezra Healing?
Yeah, so in 2021, I was fired for refusing the vaccine. And I thought, well, one, I'm out of a work. Okay, so I need to get back to work to provide for myself. Two, I know of a really great cause to get back to work, and that is helping people with vaccine injuries because I knew there was a market for it because I had been living it for the prior year at the doctor's office. So I thought, let's open up Ezra Healing. Let's just be a place where people can come to, have their vaccine injuries acknowledged. We can start helping these people. I found out that ivermectin, you know, we went from treating COVID-19, the bioweapon with ivermectin, to literally helping people with vaccine injuries with ivermectin, which led into helping people with cancer with ivermectin. So it's just been a continuum. Started Ezra Healing, spoke at all the rallies, did all the podcasts that I possibly could, connected with as many, Canadians and Americans and United Kingdom people that I possibly could. And we just built up the network and we made this into, a grassroots movement that turned into, a viable business. I made a business out of vaccine injuries. Am I proud of that? Am I proud of my country that, I developed this role for myself? Well, I'm going to be honest, not really. But somebody had to do it. Somebody had to acknowledge vaccine injuries, you know. So I just filled the gap and I wanted to help people, at such a level where, I didn't see very many other people doing it, very many other nurses or doctors doing it. So that was my, I took a Hippocratic oath, do no harm. And then I carried that out. I divorced my college of nurses. They were part of the problem. They were encouraging us to get the vaccine and not talk about, what we were seeing at our job site. So I just went rogue. I went wild, wild west. I just went sovereign healer, with no attachments to any organizations except for, the creator, God. This is faith over fear. I mean, there's obviously a lot of moments where you're just like, you feel like the world is against you, but you know what is right. And the people that are injured, help drive me to continue to do this. So, we're going into year 5 of Ezra Healing. We're strong Canada. We're growing in the US and the United Kingdom. And we're just doing what we've always done. We just speak the truth. We find solutions to people's health problems. And we, create a very strong foundation for the new wellness paradigm. Currently, we have nurses that work for us. We have admin, shippers, technical support, HR support. I want this to be a parallel system to, the medical matrix. We're the new wellness healthcare paradigm. We're helping nurses and doctors hopefully come out of the medical matrix, over because, there's still a lot of good people, I believe, in the medical matrix, but they're, they don't feel like they have another option. So what we do best with our competitive wages because people need to live, people have bills to pay. So, it's growing at a very fast rate. And I believe we're making such an impact that obviously we have the haters. We have big pharma that doesn't really appreciate us. But, what God has built, no man will tear down. And we're living proof of that.
So you've been going for 5 years, and has it been a struggle, or is this the first thing that's happened? This recent raid. Can you explain if you've gone through any struggles, like trying to build up the business, getting licenses, any legalities, and then how did this raid come about?
I stay very clear away from legalities and licenses. Those to me are my worst nightmare. I don't get involved in anything like that. It's just ties to the government. We've been going very, very strong as people wake up to what the medical matrix is all about. They're looking for alternatives, so they come find us. We're mainly, referral based. We get a lot of referrals. That's how we grow. So I had somebody in my life that didn't appreciate what I was doing, that they reported me to Health Canada. So I literally had a rat in my life. And two people, actually, one person, her name was Emma. She worked for me, and she was my inside spy. I had an inside spy that was delivering information to an outside source that would then filter it to Health Canada. These are both people that I've paid well. And Dave Drover also, I helped him not take the vaccine. He was a family friend. So, we've had people turn on, our neighbor for whatever reason. So it was a very unfortunate event. I don't believe Health Canada would have known the information that they did if it wasn't for these two people involved. But, it's that karma has a program, and Canadians who are ratting on other Canadians trying to make Canada a better place is really unfortunate, but it's true. I think we've all experienced that betrayal. But betrayal, Andre, is basically just prior to the step above, extreme leadership. So, you have to have tough skin for this role. And because my focus is saving the children at all cost, I will take all the lashes that come at me. Because they are basically a portal that I get to jump through to the next level. So the Health Canada raid was so good for me. It was so good for business because mainstream media, Global TV, CTV, Castanet, and a few others all approached me and asked me if I wanted to do an interview. And of course, I said, sure, let's use this opportunity on mainstream media to get the word out about vaccine injuries, cancer. Okay, those are my top two. And the amount of feedback that we have gotten from the general public has been absolutely overwhelming. The amount of testimonies that I've gotten from our clients over the last 4 years have been overwhelming. We have such a strong case that the vaccines have caused injury, harm, and death. So it only worked for the good of the awakening. So no regrets. And, we will use any dark forces and we will just shine our light on it and we're going to rise. We're Phoenix rising. We're the underdogs that are going to come out on top. There is a flow to what's happening, the timeline. I'm not in charge of it. I am just literally a vessel for the creator and to do the work through me. That's who I am. And we have a wonderful team of about 15 people all over basically the world now. And our team is only growing. So, we really sit on the do no harm model of care. And any setback that comes our way, we're going to just overcome it. It's just how it's going to go.
Okay, that's great. Now, you did mention on one of the interviews that you've recently done that you're very certain that ivermectin cures cancer. And I would like to ask you, what makes you so certain that it's working? Like, what kind of proof or evidence have you observed?
That's a great question. And, I've always worked on evidence-based medicine, evidence-based care. We don't want to make claims where there's no strong evidence. So I love that you're asking me this. We have 3 years of proof in our clients. We have people with full-blown diagnosed cancer with tumors on an image, CT scan, MRI, that come into our program, and we put them on our program, and we follow them. They go back to their family doctors or oncologists for a repeat CT or MRI scan, and those tumors shrunk or gone. So this to me is the research going on. It is not at Harvard behind closed doors funded by Big Pharma. This is real in live time research. Our products, they're really great. We get them third party tested. We get them from a really great source in India. We get them third party tested in the States. Our clients are confident with them. We have amazing nursing care and they follow what we have to say. It's very simple. It's your diet. It's your mindset. It's what you put into your body and it's what you don't put into your body. This isn't rocket science. So we just support them. We hear them. We love on them. We make sure that they're followed up with, and then they go back to their family doctor and their tumors are shrinking, or they don't even have to go back because they just know their body is feeling better. And feeling better is a massive sign for us. We don't need a blood work to say you're better. We don't need an imaging scan to say you're better. The body just knows, are you getting better or are you getting worse? And we really help people get back in tune with their bodies, to start listening to their bodies. We even have a personal trainer, an in-house personal trainer, Lucas from California. Okay, he will work with people to set up an exercise program, no matter where you're at in your fitness industry, whether you're, a top-notch, fitness competitor, or if you're in a wheelchair. We will find something for you to do to move your body. We will find the best food for you, for your body. And we will tell you whether you need ivermectin or not. We will help you with these vaccine injuries, and we will help you with mindset. We have these healing prayer meditations, because what you put into your brain is really important. Just think about all the people who were infiltrated with the news. Take your vaccine, save your community, and people actually did it. What if we fed people different information? So we have actually healing meditation prayers where people can listen to how to heal their cancer, because people can do it and they are doing it. So this is my evidence, Andre. It's not very fancy, but it's very effective. We've just hired a nurse out of Florida. She's our new research and development director, where we're going to be putting these into more formal, readable papers. The testimonies are coming in. We're going to organize that. We have been under chaotic circumstances, obviously not the way we like to work, but it's how it's been working. But as we get more established and stronger financially, we can start becoming more organized and presenting this research to the general public.
I think it would make a great documentary. My dad, he went through going through a heart transplant, and he was so grateful to the medical industry for saving his life. In 1999, they predicted that when he had a defibrillator installed on his body, that he only had 10 more years to live. And then to the date, his heart failed and he had to go on a heart pump, and he was waiting for the heart transplant, and he had a pager, and the pager went off, and he went off to the hospital to get this heart transplant. And it was a long recovery. But I remember talking to him, and he would say, I'm just so grateful that, we have this amazing health industry in Canada that's free. Like, if he had lived maybe in the United States, it would have cost him millions and millions of dollars to go through what he had gone through. And I'm not sure if that's true, but he was very grateful. And he wanted to share his story with whoever. Like, he was just so grateful. He felt like he owed society his story. And I feel like your clients will feel the same way as you heal them from their cancers, that they'll want to share their stories. And maybe it's a great idea to make a heartfelt documentary, with the tears and the results that you're producing, to change those tears into hope for the future. So I'd be happy to help you with that in any way. And
Thank you, Andre. I really appreciate that. And I love that, because it is the heartfelt stories and the testimonies that will change the world. It is when people start to shift in their heart, and they get to actually witness a genuine person with their real life story. Absolutely. So I want to comment on your dad's 10-year plan, like his 10-year down to the day.
Yes.
Okay, so this is the power of the human mind. He was given this information exactly 10 years.
Right.
And you said exactly to the date. Okay,
Yeah.
so in his mind, he's counting down.
Right.
Okay, there is no coincidence that it actually happened in 10 years to the date, because he programmed himself like that.
That's right. He manifested it with his mind. I understand this.
Did you ever think of that? Did you ever feel that?
No, it kind of just clued in right now.
If we program ourselves how we want to see ourselves set up, how we want to see ourselves in 10 years, not the doom and gloom part, but the vitality part, I think we can get there just the same. So we have the choice of what kind of path we want to take. Now, when you have a care provider, like the doctor saying you have 10 years before you need your next one or your heart's going to stop, and that person takes it literally, that's a seed and you're programming your body. So at Ezra Healing, we recognize this and we want to program it differently. We want to program it for longevity. We want to program where you'll actually never need Ezra Healing again, because that is real healthcare. Real healthcare does not discriminate. Real healthcare tells the truth. Real healthcare is integral. Real healthcare does not do harm. Real healthcare is empowering, not disempowering. That comment that the surgeon made was disempowering. So we want to get people in front of a situation where they're empowered. People want hope right now. That's all. Let's just give people hope, and not false hope, but real hope, because we have testimonies, we have evidence now of this. And I'm very, very grateful. I'm grateful for the opportunity to bring this to light. I'm grateful for my 25 years of nursing history. I'm grateful to have been married to a family doctor where I got to see a very different side. I am grateful for, even the pandemic. I'm even grateful for the plandemic. Do you know why? Because a life lived on a lie is no life at all. And we discovered through the 5 years of plandemic that we were living a life on a lie. And no wonder life didn't feel very meaningful. No wonder it was sort of boring. No wonder there's just so much destruction in the world, because we weren't on the right path. It got us onto the right path. And I wouldn't change it for the world. I even lost my children over this, Andre. Do you know that? I lost my babies in 2022 for refusing to vaccinate them. My ex-husband at the time wanted to COVID-19 vaccinate them, and I did not. We had major disagreements. I didn't take him to their vaccination appointment 3 times. I got called into court. I lost custody of my children. They were 9 and 11 at the time. But I stood with what I believed. If I had made up a story in my head, got them vaccinated, I don't think I could have lived with myself. I have no regrets, because the truth is coming out hot and heavy. It is the mama and papa bears that are driving this. We are literally the healing gang of the planet. And we will not tolerate this. We will not tolerate them hurting our children. We will not tolerate this moving into future generations. So it stops now. And that's our role. And that is who you are. That's who I am. And we have thousands, if not millions, of other light workers, rainbow warriors, healers, whatever you want to call us. We've been activated, and we just know what to do, because I believe we were pre-programmed to do this on Earth. And when the pandemic showed up in 2020, something just clicked. It was like the key that turned the lock. We just knew what to do. We were programmed. And here we are. We're still at it 5 years later, Andre. 5 years. It's been a long 5 years, hasn't it? But it's gone by very fast. I predict the next 5 years will be wildly, insanely beyond anything we could ever imagine. And it's going to be for us, not against us. It's going to be a lot easier than the first 5.
Thank you. That's great. We should kind of finalize things. Would you like to talk about the raid and what's happening right now?
Sure. Sure. So October 30th, we were all working a normal work day in Kelowna at our office. We had patients there. We had workers there. We then had a surprise knock on our door to RCMP, escorted by 2 Canada Health inspectors. They picked our lock with a butter knife. They broke in. They had no warrant. They proceeded to box every supplement up. It took them about 3 hours. I got there about an hour after the raid. They said, "Oh no, you're not in trouble. There's nothing criminal here. You just can't have these, medicines on site because they have no drug number." I proceeded to make that video. I proceeded to plead my case about all the vaccine injuries and the cancer I'm seeing, and that's why I'm doing what I'm doing. They actually said, "Oh, that's a really good idea. You should just get some license numbers." they packed up their cars with medicine. Then they drove off. I actually went to the police station after because I wanted to see this warrant. My lawyer had suggested that I do that. I get to the police station. I speak with Constable Peters, who had been there earlier. He said there was no warrant. Whether they needed one or not, they just barged in. They took about $200,000 worth of product. So we are just in recovery mode. We are going to continue on with our advocacy work, and we're not stopping talking. We will be referring out our product now to a different source, to a different, really good quality source. But you can't take somebody down who believes in this so much. So, like I said, I think it only worked for us, not against us. It got us onto mainstream media, and a lot more people are coming forward with their vaccine injuries, which is wonderful. So we're just going to tighten everything up and carry on.
What happened to all those supplies? Are they gone forever?
Yeah, they took them into their custody, and they're going to dispose of them, they said, and I actually have to pay the disposal fee.
I'm so sorry. What for Ezra Healing, what kind of people would you like to say should come to Ezra Healing?
We love to see everybody, vaccinated, unvaccinated. It has nothing really to do with that. It's if you need healthcare, if you need proper healthcare, if you need somebody to be honest with you, if you want somebody to hear you, we work with all kinds of people. The best thing is to go to ezrahealing.com, look up our consultations. You're going to see what kind of offerings we have. We have a wonderful nursing team that is ready to talk to you. We have a free triage appointment, a free 15-minute triage. If you just have a quick question about anything healthcare related, we're here for you. We have free baby wellness consultations, 0 to 12 months or age is free. We have a wonderful 3-month package for you. It's basically you get your private nurse for 3 months. To me, 3 months is a really good time frame to start on a challenge and see some results. We have a medication management consultation. We help people get off of big pharma medicines, for example, like cholesterol lowering medicines. We need cholesterol. If you take cholesterol away from our body, it interrupts the vitamin D pathways. So we just help people understand. We educate on the harms of some big pharma medicines. Ozempic, we get people off of Ozempic. Ozempic's causing blindness and bowel paralysis. So we have peptides, to help with weight loss. We have exercise programs. We have a better way of eating. So, we're just getting back to the basics with really good support. We have a great electronic health record that we do all our charting on. It's very safe and secure. We have access to it. You have access to it. So, we're growing all the pillars. EzraHealing.com. Speak with the nurse. Watch our podcasts. We're growing. We want to collaborate. We don't want to be competitive with anybody. I really don't want to be competitive with anybody. I want to collaborate with like-minded businesses and networks. And that's how we're going to grow the new wellness paradigm together.
Well, thank you so much, Svetlana. It was a pleasure speaking with you, and I hope that we can possibly make a documentary or some more videos on the success of Ezra Healing and yourself, and sharing your story with the world. I think it's fascinating.
I would love that. I would love for you to connect with our clients and have a conversation with them and make a documentary out of that. I think that would be powerful.